The Dutch cruise ship at the center of the outbreak was hit by a specific kind of hantavirus, the Andes strain. So, what do we know about it? And what do we know about a whole other threat that could be right in our own backyard? Dr. Fahad Razak is an internist and epidemiologist at St. Michael's Hospital, an associate professor and Canada Research Chair at the University of Toronto. And he joins us in studio. Great to have you here, Doctor. How are you doing?
Great to be with you.
All right, hantavirus is pretty new for a lot of us, but it comes with a mix of fear and misinformation. So I'm hoping that you can help cut through the noise, walk us through what's true or what's false. What do you think?
Absolutely.
All right, true or false? You can catch hantavirus from insects like mosquitoes, ticks, or fleas.
So that is false. Most hantavirus is spread through rodent waste. So, for example, let's say you had a shed in rural British Columbia. The waste that's in there, you're cleaning it, it gets into the air, that's how you get it. The thing that's slightly new about the new version of hantavirus, the Andes virus, is there are some cases now where it can go from human to human.
Okay. True or false? Hantavirus is a respiratory illness with early symptoms similar to the flu.
That's true. In the majority of cases, the first symptoms are flu-like symptoms. It's things like fever, chills, fatigue, headache. Then it progresses to a very severe respiratory illness for most people. There is also a version that gives you more severe kidney disease.
All right. True or false? Hantavirus spreads easily from person-to-person contact.
So that's false. Up till the Andes virus, in fact, hantavirus does not spread from person to person, only from a mouse, a rodent, for example, to humans. The Andes virus version can spread to humans and from human to human, but it's in this unusual circumstance of intense, prolonged personal contact, like a cruise ship.
So we would classify as zoonotic.
Zoonotic, correct.
Zoonotic. Yeah. All right.
Yeah.
True or false? Hantavirus has the potential to become the next COVID.
Yeah, thankfully false. Everything we know about hantavirus and the Andes strain suggests that it does not have pandemic potential. It doesn't spread easily through the air. Importantly, people who are minimally symptomatic can't spread it forward. So one of the big challenges with COVID was that people didn't really have symptoms, but they were already spreading it to others, so you could have a lot of spread. We also don't have a virus that rapidly mutates like COVID. It's very stable, so it doesn't develop those new variants that we struggled with.
All right. True or false? Hantavirus can be diagnosed by a blood test.
That is true. The blood test principally works on two different ways. The first is it looks for the genetic material of the virus, or it looks for your antibodies responding to the virus.
Question on that. Are these blood tests pretty easy to get?
They're not something that you would get in a family medicine office, for example, but we have a coordinated way through our public health units and through the central lab in Winnipeg, where we have an ability nationally to rapidly get an answer to whether someone is positive or negative. You saw that in British Columbia over the last week.
All right, and that would be something that you would have to, not just something that you get at your pharmacist or GP.
Correct. This is not a pharmacist GP test. This is a hospital specialized test. That's right.
True or false? Hantavirus has a 20% to 40% mortality rate.
Yeah, it does. It's a very, very significant infection once it occurs, and it's primarily through that very severe lung impact. So people will have deteriorating lung function, not able to absorb oxygen, go into hospital, be on a ventilator, and unfortunately about 30% of them die.
Can you compare that to, say, COVID? I think a lot of people, when we heard about hantavirus, that's where our brains went. How does that compare to COVID?
So dramatically different. So in COVID, it would be under 1% for the general population. Oh, wow. So this is a very, very different disease. COVID spreads very easily. The impact for COVID was that societal, many people getting infected. So even 1%, let's say, is a big number. Here, it's very rarely spread, but when you do get infected, it's very severe.
True or false? There is nothing you can do to stop the spread of hantavirus.
In fact, there's a lot that can be done. So remember, again, hantavirus has been around for decades. We know that it's a rodent spread disease, and things that you can do include preventing rodent exposure. So for example, many Canadians live in rural settings. If you have rodents in your shed or in your garage, there's a lot of strategies you could do. You could plug all the holes, you can get an eradication service, you close water and food so they don't have a food source. And then if you're cleaning up the droppings, for example, you can wear a good mask like a respirator N95. And also you try and prevent it from getting into the air. So you wet it down first and clean it before you, let's say, vacuum it.
All right, Doctor, thank you for helping make sense of all of that. Really appreciate you taking the time to help us better understand all this.
Yeah, great to be with you.